to everyone who's watching this video, I guess. This is going to be a video on sexism in hospital setting or a medical setting or whatever, just to do with health. I recently saw a BuzzFeed video about this. This is a matter that should not be taken lightly. So I'm just going to be one of the many women to really share my story about this. I know that there's tons and tons of people out there who, even men, get treated sexism in like a medical field place, but this is just more for the women. I mean, I got a bunch of stats here on my phone that I decided to look up. I got like I typed up my story and everything as well, so you guys kind of hear what I went through and see if you guys can relate. I know that it's very difficult to really make yourself heard, and that's what you really need to do in order for doctors to take you seriously. And it's not really a light issue. I know that some people are like, well, maybe you're not finding the right doctor, maybe this or that. It's with a lot of doctors. Doctors wrongly perceive women as being more irrational and emotional than men, and therefore dismiss their complaints about pain as being all in their mind rather than having a physical bias. That is completely true. I know a lot, not like a lot, but I know a few people, women, who actually went to the doctors and complained about their pains. Instead of being, hey, let's treat you for this or for that, it's more along the lines of, why don't you try an antidepressant? Hey, have you seen a psychologist or a psychiatrist lately? It's PMS, you're gonna be fine. When was your last period? Here's birth control. Men are scared due to the fact that women have way more complicated anatomy than men do. And I think because of the whole vagina and all the things that we have in there, I believe that they don't have an answer, and I don't think they don't care. Maybe some don't care, but they don't have an answer, so they base it off of the vagina. They don't want to go ahead and say, your headache? Yeah, let's get that checked out. Let's get an MRI. Let's do this. And I don't know if it's because they're kind of like, well, we have other patients with a different matter, or if they're more just scared of the anatomy that we have, and it's just kind of like, it's on the vagina. Maybe it's your ovaries, maybe it's this. Let's send you to an OBGYN and see what they can do instead of me. Even though I deal with headaches and I deal with the brain and all that, and it's kind of just like, okay, let's see what they say. So I think a lot of men are just scared. Most doctors who are women kind of sympathize with you, but even though they're like completely scared for you, a lot of them want to just base it on periods because they assume, hey, periods can do a lot of physical damage. So I think that's just kind of what happens a lot in places. Clinical studies have found that doctors are more likely to think women's pain is caused by emotional issues rather than physical causes. There are more than 5 times as many scientific studies about erectile dysfunction as there are about PMS. Although 19% of men report suffering from erectile dysfunction, 90% of women experience PMS symptoms. This topic is so sensitive for me because I didn't really realize that I was part of the whole sexism thing until my friend brought it to my attention, and he was like, you're not getting the help you need. They're treating you like you're insane. I realize now they are, and a lot of times when I go back to doctor's offices for the pain I'm having now, the last 3 visits, one was a male doctor, and he completely blew me off. It wasn't even worth a $200 visit or whatever for this guy to just tell me, you know, this is happening, whatever. But the other 2 times, it was a female doctor, and she tries so hard, and it's so nice. Unfortunately, though, they're just not helping me on what I want with my issue, so moving past it and finding someone different. Women were more likely to be given sedatives for their pain, while men were given pain medication. In 2015, first time I've ever been to the ER by myself. I recently turned 18 a few months prior, so I kind of was able to go on my own, and I was with my boyfriend at the time. He came with me, and I told him, I was like, hey, I'm having like abdominal pain, like where my ovary is, my right ovary, and you know what, they gave me morphine. It's kind of touchy because morphine is pain medication, but it also can sedate people. I felt really nice, but I was really out of it. That was okay that they gave me morphine, but it was more or less all the times after I went, they wouldn't give me any pain medication. Not even for nausea. Like I would be gagging or throwing up. They wouldn't even give me any like Zofran or anything for nausea. Nationwide, men wait an average of 49 minutes before receiving pain medication, while women wait an average of 65 minutes for the same thing. Again, women aren't taken seriously for their issues. They kind of don't care. I mean, they kind of just wait, and then finally they come in and say, hey, pain medication. Because 49 minutes to 65 minutes, that's like a whole 20 minutes. And it's the same problem. Right here, they had the same problem, and yet the women waited almost an extra 20 minutes to have given pain medication. So yeah, let's, 10 minutes in, let's get to my story. I'm going to put like a little blocker here. So if you guys want to like skip to the end or whatever, I'll put like blocks of time so you guys know like which is where, just so that's easier for you guys. Took 3 years and 4 different doctors before I was diagnosed with interstitial cystitis. I was 15. I started getting chronic UTIs to the point where I would go to the doctors like once or twice a month for UTIs. I went to the hospital a few times. In the emergency room as well with my mother, to urgent cares. They just write it off as kind of just like, you have blood in your urine, so it must be a UTI. That was basically it. They never did any blood work on me. I went to 4 different doctors in a span of 3 years. They gave me antibiotics and that was it. Finally, I went to a female doctor. I told her all my problems. She was telling me, you know what, this sounds like interstitial cystitis. I want you to see a urologist. Now, I've been to 2 different urologists at this point. One of them actually just did I don't know what it was called. They did like an IV and it did like fluids to see like my kidney functions, and then they took like x-rays of it. That was it. They did nothing with my bladder whatsoever. And then I went there to him and he told me, hey, you look fine, there's nothing we can do for you. My mom got really pissed at that one. Finally, I went to this urologist. She was a female. Well, the nurse practitioner was a female who I met with. The urologist I never really met with until like surgery days. But she was so friendly and so nice. I've seen her for 3 years, 2 years. She was literally the most friendliest, like, she wasn't really a doctor, but I'll say she's a doctor. The most friendliest doctor I ever met with my bladder issue. Interstitial cystitis, it's kind of just chronic UTIs, and if you get chronic UTIs, it's not like that. It's just where your bladder bleeds a lot. So I have something called like ulcers in my bladder. I don't really know how to explain it, but it's kind of like little cracks in the bladder. And when it fills up with water or something, it can expand and then it can bleed a lot. Or even then, just bleeds on its own. If I eat something bad, I get bladder pain right there. It's just really hard thing to deal with. She was so friendly, and even my urologist was really friendly, and he knew like this was a tough issue. There's no cure for it at all. They don't know how it happens. A lot of people say hormones, but I don't believe it's hormones at all. I was on several birth controls and still I had pain. After I had my surgeries and everything, I'm good to go. I'm getting surgeries every year. That's exciting. We're gonna talk about my pelvic pain now because that's really, it's been 2 years since I went to the emergency room for the pelvic pain and they still have no idea what's wrong. Oh, also, I self-diagnosed myself with interstitial cystitis before any of the doctors did. So, if you find something on the internet that you think is your problem, talk to your doctor because that was my 100% problem that I didn't do with any of the urologists. I never said anything because I was like, they're doctors, and I'm probably just overreacting. No, it's your body. You should do what you think needs to be done and speak out about how this doctor is treating you and how you want to be treated, or about your pain, or whatever, and don't believe that you're a hypochondriac, because I thought I was for 3 years because doctors couldn't find what was wrong with me. And hey, look, I have interstitial cystitis, a serious bladder condition, and you know what? It's so nice to finally be diagnosed with something and I can actually say, hey, this is my problem, you know, without sounding like I'm overreacting. I'm just going to read this and then I'll stop and explain things and then keep reading because this is kind of a lot of information for me to kind of like intake right now. Kind of summarized on my phone by a really long paragraph. In the past 2 years, I've had constant cramping and severe pain in my pelvic region. I've been to the ER several times, and I mean like several, like 9 times at least. Seven or 9 times at least, because it was just so severe that I've always had painful periods and always like heavy periods. This was so bad I would start throwing up because my cramps are so bad. I always thought it was normal to have super heavy periods like this. I knew that this cramping that I went to the ER for, I got my period like when I was 12, I was 18 then. So I just kind of figured that this pain wasn't normal. So I just kind of thought, hey, I need to go to the emergency room. I went to the emergency room, I think it was like 9 or 10 times for this pain. So the first time I went to the emergency room, they gave me morphine, which is what I talked about previously, and they thought that it was a serious issue, so they did a CAT scan, they did an ultrasound, they did a pelvic ultrasound, pelvic exam, you know, they did a lot of things, and we were there for 8 or 9 hours, and they actually treated me like I was a patient instead of like I'm crazy. So that was definitely what I wish it was like all the time. And they gave me Zofran for nausea. They actually treated me like I was human instead of this emotional person. The second time I went, it was at night. No, I went twice in the same day. Isn't that crazy? So it was like August 8th, I think in the morning or afternoon. They did nothing. I went back later that night because I figured, hey, I'm still having the pain's still there, something's wrong, something serious is going on with me. I've had this for a couple months now. What is wrong? Well, this is the worst emergency room visit I believe I have ever encountered before. Me and my friend went there. He goes with me to emergency rooms all the time and he hates it. But he and I went there. We got there around 10, I think, 10 at night. We went back around 11, 12. This guy, he was a nurse. He was a male nurse. And he's like, okay, well, we're going to draw some blood. We're going to, you know, send your blood work or whatever, and we're going to leave the IV in case you need fluids. It rolls around to like 2 in the morning. My friend's tired, he's fallen asleep on me. I'm tired, I'm starting to fall asleep. I have the TV on trying to stay awake in case the doctor comes in. Around 3 o'clock, the guy comes in. You know, your blood work looks fine, blah, blah, blah. 4 o'clock rolls around. We have not been seen by a doctor at all. No doctors ever came in. Nobody. Except this nurse, and he only came in twice. Twice. First time to give me my IV and blood work. Done. And then the second to see, hey, how are you doing? I still have no fluids at this point. Nothing. Nothing was done. Still got the IV, whatever. Then I was like, well, hey, we haven't been seen by a doctor yet. Can you get this IV out? He's like, yeah, hold on, give me a minute. You're already in the room. Why can't you do it there? Another hour rolls by. It's like 5 in the morning now. He comes in, he takes out the IV. He's like, okay, let me get your paperwork. 6:30 rolls around. It's like, fuck it, we're leaving. I didn't sign any papers, I didn't sign any discharge papers. I was like, fuck this. We have been here for 6.5 hours and have not been seen by a doctor. I was like, this is complete bullshit, and I can't believe they're doing this to me right now. And I think it's because they believe, like, I was, you know, crazy, some psychological thing in my head. And it just kind of really pissed me off that I even went there that day. When I went August 9th during the day, the lady I met with, she was a resident, she came in and she gave me 800 milligram ibuprofen saying it's PMS. I was like, okay, well, maybe it's just PMS. Now we're in October. I skipped September. Congratulations to me. And we went to October 26th, somewhere in the end of October. Went in again for pelvic pain. They did ultrasound, transvaginal ultrasound, all this stuff. They're like, you have a pelvic inflammatory disease. What's that? An infection in your pelvis, where your organs are and all that. They gave me antibiotics. They gave me nausea medicine. I had to stay overnight so they could do like intravenous antibiotics. Well, they gave me two-week antibiotics to take. Well, my body couldn't handle one of them, so I had to go to the doctor's the next day for a shot. I had my surgery in December for my interstitial cystitis. 2016 was an okay year. I didn't go to the emergency. I went to the emergency room once or twice, though. One time, it was when I was home, and this is a different hospital. They didn't do anything, and I literally started crying. I called my best friend because he couldn't come to the hospital with me or whatever, so I called him and I started crying and bawling my eyes out because they didn't believe me. Anyway, the doctors, every time I went in, they did pelvic exams. They didn't really say much. They would give me amitriptyline, which is an antidepressant, but they say that it's used for pain medication. I don't want to believe that. I'm pretty sure that it may help, but it's not gonna help everyone. So I don't know why. Just recently, my last doctor visit a week ago, they gave me Elavil. And I was like, okay, let's try Elavil. Little did I know, it's actually amitriptyline. So they just keep prescribing things that I've already tried. Let's see. Oh, recent diagnosis. I can't even say the word. It's like myofascial pelvic pain or something. Myofascial pain syndrome of the pelvis. I don't even know if I'm saying that right. Maybe I'll put it like here or something, or like up here, because I don't want it like, which means you just have pain. And you would think pain means pain medication. They prescribed me to go to physical therapy and stuff for the use of the muscles and everything. This is where it kind of gets tricky because I don't believe that maybe I have pain well, I know I have pain, but it's not like a pain syndrome. I believe that there's something else down there. I've had ovarian cysts for several years, ever since I was in 7th grade, and I'm 2 years post high school. Almost 3 years, because high school starts soon. I don't know. I always thought like ovarian cysts were bad and everything. Well, I keep getting them. And keep getting them, even though I'm on birth control. I have an IUD, and ever since I got the IUD, which is almost a year ago, my pain has been worse in my pelvic region. So like, I will double over in pain because it hurts so bad. I'll be walking or doing activities or whatever, and I'll just have to stop because it's so painful. My periods have been like 14 days long or more, and all the doctors do is prescribe me birth control to put on top of my IUD because they think that I need like a low estrogen pill. I don't know if estrogen, like, I have the Skyla. I know it's lower than the Mirena, but it's kind of just, it's a birth control. My periods shouldn't be doing at all, regardless. They're still the same flow, basically. There's some of them that are lighter. They're worse though. They're 14 days, like, continuous 14 days. My periods were normally 6 days. Like, I get pelvic pain all the time. I used to be able to go for car rides, like long car rides. Now I can't even get in a car and drive for 5 minutes because it's like, I don't know what it is. When I sit in the car, I don't know if it's because I'm pressing on the pedal, that when I press, I use that muscle and everything tenses up and it makes the pain so much worse. I self-diagnosed myself with endometriosis. That's a very, very serious issue because what happens is tissue grows outside of your organs. So it can happen on your bowels, it can happen on your ovaries, your uterus, your tubes, all that stuff. Endometriosis could be anywhere in your body actually, and people don't understand that, but it's mostly just kind of in the pelvic area. That's what I really believe I have. My last visit, when they prescribed me Elavil, I told them that I was going to see a specialist for endometriosis for a laparoscopy or something, something like that, laparoscopy. And my doctor, the female doctor who actually prescribed me the 800 milligram ibuprofen way back in 2015, for PMS. She's actually the person I go see now. She was telling me how they do like the procedure there, which is true, yeah, but this is a specialist who knows what endometriosis looks like, because a lot of doctors don't understand and they screw up your surgery. I'm gonna call it lap instead of laparoscopy because I can't say it. That screw up your lap, and a lot of the tissue doesn't get fully removed, so it kind of comes back. I mean, when you see a specialist for endometriosis, you have a very, very high rate of it not progressing or coming back versus going to someone who's not skilled in the whole thing at all. I mean, I wish I could tell you facts right now on the success rate of a specialist versus someone who just does like regular OBGYN work. Endometriosis is such like a hard thing to do because you really need basically surgery to say that you have it. I mean, you can get an MRI done, but MRIs don't 100% tell you unless you get the surgery, and surgery is the only way to do it. So I want to have the surgery done right and done right the first time instead of spending $10,000 and realizing you didn't remove all of this, and then going to see someone else and realizing, oh shit, this first doctor just completely ruined my ovaries. I just want to say, like, sexism is so real. It's just a matter of who you go see and who is a supporting doctor versus someone who just wants to make money. And I've realized that a lot of them don't want to help young women. I read online that doctors who find you attractive, I'm not going to say everyone, isn't beautiful or whatever, but doctors who find other patients attractive aren't treated as fairly as people who, are in pain or, looks like they need help. Because you're attractive, you don't look like you need help, so they realize you look like you just want some pain meds and that's it. I wish I didn't have to look like a slob in order to be treated like I'm in pain. You could be going about your day, hair done, full of makeup, a beautiful dress, heels on. You could be throwing up your intestines. Go to the emergency room and the doctor goes, well, we're gonna do a bunch of tests, but because you're a woman and you're attractive, you're gonna have to wait about an hour for pain medication. And we're not gonna treat you as fairly as other patients. It just sucks because unless you're physically showing signs of distress and you're bleeding out and all that stuff, but they're not going to treat you as fairly as males. Unless you find a female doctor who will work with you, who will be there by your side, who will believe you, it's really difficult in today's world because doctors, there's still a lot of high rate of male doctors going, and practicing versus women doctors. And I just hope that we have more female doctors than male doctors one day, because female doctors are so sympathetic and they seem like they care about you a lot more and they'll work with you versus someone who, completely just jumps to conclusions and say, this is PMS, you're emotional, you need antidepressants, are you bipolar? You don't need my mental, history in order to treat me. I just want to say one last thing before I go. If you feel like you're not being heard when you're at the doctor's or in the emergency room or whatever, make yourself heard, because the pain that you're feeling is probably real. Maybe I have PMS symptoms, but it's not my full diagnosis. And my interstitial cystitis took 3 years to be diagnosed with. So I want everyone out there, even this doesn't have to apply to females anymore. If you want to tell your doctor something, tell them, and don't feel like you're coming off as mean or rude, because it's your body, and if your body's telling you that there's something wrong, then there's probably something wrong. If you look online and you see all these symptoms, it's probably the diagnosis that you have. And tell your doctor and let them know that, hey, I looked it up online, and if they hit you with one of those, I have the doctor and you don't, then find a different doctor. And I know that it's hard now with insurances and everything, but it's really important that your health is tip-top shape, because without your health, what do you have? I just want, everyone to feel like, especially in today's world, that they're getting the right treatment for their health and that, they can actually live their life, because I can't leave my house to do activities that I want to do without having anxiety about being in pain, or having anxiety about, you know, what if I need a bathroom and there's not a bathroom around. I don't want people to go through what I'm going through. And I hope that one day, that people who are suffering right now, that one day you find a doctor who actually knows what your needs are and knows what's wrong with you and knows how to help you, because that's really important. A good support would be awesome, and I know a lot of people struggle with that, but it's good to have, like, just even one friend. I only have one friend. My parents aren't supportive of me, but one friend is all you need, and he means the world to me because he tries so hard, and he's the one who always tells me, you should make a doctor's appointment for this. He always says, hey, I can take you to your surgeries. Hey, I can take you to your appointments. Or, you know, do you want to come over tonight and spend the night? Because your appointment's at 8 in the morning. I don't want you to drive through rush hour. And it's just so nice to have someone that's so supportive. And yeah, sometimes it's a little hard for them. I've had him say, you know what, maybe you're overreacting a little bit. And it's true, sometimes I overreact, but in some aspects, it's so difficult not to overreact, because in order, you know, to be heard, you need to overreact a little bit. If that's what you have to do to your doctor, that's what you have to do to your doctor. I just hope that everyone gets the care they need, that all you guys are happy and healthy, because it's everything in today's world. You know, like I said, if you don't have your health, what do you have? Alright, so this is a super long video. Alright guys, so I hope you all enjoyed this video. I think I'm gonna do some more topic issues like this because this is really important, and in today's world with all the issues we have, I believe, you know, sexism is very much still alive. Just something to think about. So I hope you guys have a good night and all the positiveness comes towards you, and just have a wonderful day.